Hello, everyone, and welcome to Headwise, the podcast and videocast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I'm the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. I'm super excited to tell everyone that I am here today with someone who is very popular in our community. This is Dr. Bert Vargas. Hi, Dr. Vargas. How are you doing today?
Hi, Lindsay. Thank you for inviting me back onto the podcast.
Well, thanks for being here. Dr. Vargas is a headache specialist and a very familiar face to many of us who are advocates in the migraine community. He works hard advocating for people with migraine. We see him at most of our advocate meetings, functions, etc. And today we're going to have a heart-to-heart chat with Dr. Vargas about some of the gaps we have in our communication process with our healthcare providers when it comes to the impact that our migraine disease has on our lives. In other words, all the things we go through, not just the head pain, but all the things that we go through as people with migraine. There's been some data published recently about how migraine impacts our lives and how the fact that we might not be communicating this to our providers really impacts our care. So Dr. Vargas is one of the researchers in this area, and he is involved in something called the Overcome study. Many of us have heard of this study. It's a very large study involving over 60,000 people, looking at the treatment and care of those of us with migraine. So let's see what Dr. Vargas has to say. So
Yeah.
Dr. Vargas, Headwise has a diverse audience. We have a lot of seasoned chronic migraine patients. We have some people who might be newly diagnosed, and we want to make sure we're speaking to everyone today. So our audience knows a little bit about you. Maybe you can start by telling us why you're so personally involved in working in this field and why this message that we're talking about today is so important.
Yeah, thanks again for the intro, Lindsay. Can't wait to talk to everyone about those gaps that you brought up. And I think with all the studies that you mentioned, we found some really interesting things. I think it's really going to surprise your audience to hear what some of those root causes are. But to talk to your first question, really about my background and how I got into working with people with migraine and working in headache, it's really all about really outstanding mentorship. When I was a resident, there were no formal headache medicine fellowships. They were all kind of non-accredited fellowships. So it was very early on, and those early mentors really did an outstanding job of showing me how challenging and rewarding headache medicine is, and how it's uh, just so rewarding to work with people with migraine, especially when you can see how just being not just a good physician, but also a good person can make a really big impact on their lives and their treatment. And by that, I mean being a good listener, being connected to your patient, caring about what's happening to them, and using those things to kind of make decisions together. And those are all things that I felt very strongly about. So I have indeed found it to be just such a rewarding specialty to be in.
Well, I'm so glad to hear that. And I think that as patients, we all love to hear when a physician gets us. We love to hear what motivates them to work in this field. So thank you for filling us in on that. So as a neurologist, how do you explain migraine to your patients?
Yeah, I think that's really hitting on one of the important points that I'd like to come out of this whole podcast today
Mhm.
is the fact that migraine is really a spectrum of symptoms. And I know a lot of us, when we think of migraine, or if we hear someone say, "Oh, I have a migraine," that to a lot of people just brings up an image of headache. That's just the first thing that a lot of people think of. And some really good teachers when I was in training were just really good at explaining how headache is really just one of a number of symptoms. It's the one a lot of people think of. It's one that is probably the most common, but it's really just the tip of the iceberg. And it's
Mhm.
really about the fact that it's a neurologic disorder, of which headache is just one symptom. It doesn't include a lot of times we don't include the light sensitivity, the sound sensitivity, the cognitive effects that migraine can have on somebody, and the impact that having those attacks has on a person, even in between attacks, as they try and
Right.
plan their lives. And so I think when we think about it a little bit more globally, I think that's the first step in recognizing that migraine is actually a very big problem. It's a
Hmm.
significant disorder, a neurologic disorder with a genetic basis and a
Hmm.
biochemical pathophysiology. I think once we start recognizing that, a lot of those other issues that I think a lot of people with migraine experience, including stigma, start to melt away a little bit when people recognize those things.
Right. So many people, though, may not understand that all these symptoms they're experiencing are actually migraine, or worse, they may have not had a good experience when they sought help for their migraine symptoms, and this stops them from seeking help again. In fact, according to certain estimates published out there, I mean, how many of us actually have migraine disease? Because I think a lot of people just don't know they have it.
Yeah, you're absolutely right that in terms of numbers, it's incredibly common. 1 billion
Hmm.
people on the planet have migraine, and it is the number one cause of disability among women ages 18, I'm sorry, 15 to 49.
Hmm.
And that's significant because those are during peak productivity years,
Right.
times when they're in school, in times when they're taking on their first jobs, times when they're starting a family. So that is one reason why migraine it has such a significant impact on people.
Hmm.
And when you talk about um, just numbers alone, um, I don't think that necessarily tells the full story when you consider the fact that despite the fact that it's so prevalent, it's incredibly under-recognized and incredibly undertreated as a disease state.
So it's interesting you say that, because even myself, I recognize this in myself as someone who works in the field, who's had migraines since I was 4. I'm really quiet. When I go into the doctor, I don't mention so much of what I go through. So, what sorts of common symptoms and problems should we be mentioning when we go to have just a discussion with our healthcare provider?
Well, again, one of the things that we've learned through the Think Talk Treat Migraine program and through Overcome is
Hmm.
that impact is an important part of the discussion.
Hmm.
That, for instance, again, pointing towards Overcome and some of the findings we found in that study was that it's not about days, right? So people have a certain number of migraine headache days, let's say, and
Hmm.
migraine headache days is not what brings someone in to see a provider. It's all about the impact, actually.
Hmm.
So, and if we think about that with, other issues that we might have, other health related issues, a lot of times that driver is, okay, is it impairing me from being able to function normally in my daily routine? And so it's not really that shocking to realize that the same holds true for migraine.
Hmm.
So when we talk to providers, it's important to talk about that impact because not only is that the key driver for you as the person with migraine in many cases, but it's also going to be one of the key drivers initiating an action on the part of the provider. So
Hmm.
again, when we just talk about days, sometimes the true impact of those days gets diluted and providers are not necessarily ready to take action on a preventative component to their treatment plan. But once you
Hmm.
start talking about it's keeping me from school, it's keeping me from work, it's keeping me from social obligations and interacting with my family, that's I think when it really hits home for people and that penny drops and providers are more apt to actually take action on prevention.
Right. So we have a lot of previous episodes of Headwise dedicated to migraine related stigma, medical gaslighting, etc. If someone feels they're not receiving adequate care, or they feel uncomfortable going back in and talking to a healthcare provider because they had a bad experience, and their symptoms are not being addressed due to stigma, what do you recommend they do?
Yeah, that's a tough question because I think having that connection with your provider is so important.
Mm-hmm.
You want to establish a relationship where you have mutual respect, mutual trust, and when you feel like you're not getting that, that can really make the relationship challenging. But if you find yourself in that situation, I think it's best to assume that your provider may be coming from a place of misunderstanding and not necessarily um, lack of education or lack of knowledge.
Mm-hmm.
And really what might have to happen there is sort of a reframing of what's going on,
Mm-hmm.
taking a pause and saying, okay, look, um, regardless of what this particular provider may think of migraine or may know about migraine, they need to know that it's actually having an impact on my ability to function. And when
Mm-hmm.
you say that, and then you then ask, am I a candidate for preventive therapy? Then that at least triggers that provider to reach into that knowledge base that they have and make some decisions about treatment. Once they kind of understand what the true burden or impact that that individual is carrying.
That is a great point. If you take that extra step of asking if you're a candidate for, these medicines that we take that will help keep the migraine away, that is just a great point. I love that you said that. So data from the Overcome study that we mentioned has shown us that even those of us who have access to a neurologist or a headache specialist may only be prescribed or be taking adequate preventive medication like less than 60% of the time. How do you feel we can best prepare for those conversations with our healthcare providers, so that we get treatment? I mean, you already said one thing, am I a candidate for prevention? Do you have any other tips?
Yeah, gosh. I guess to start off with the first part of the question that you bring up, about
Mm-hmm.
56% of people who are eligible for treatment
Mm-hmm.
and seeing a neurologist or headache specialist are not getting that treatment. And
Right.
I think the first important point to make about that, and this is what I was getting at earlier,
Right.
this is the stuff that I think is going to blow people's minds a little bit, because I think there's a misperception among a lot of people with migraine, and even among providers. I think if you poll providers, they would be inclined to think that the lack of prevention is sort of isolated to the primary care space,
Mm-hmm.
that somehow they lack the education, the knowledge, or the initiative to start a preventive therapy. And then that leads people to think that, well, we just need more neurologists and headache specialists, well, we need more access to neurologists and headache specialists,
Mm-hmm.
which may be true. We do need more neurologists and headache specialists. But
Mm-hmm.
this data that we've seen from Overcome show that that's not necessarily the root cause of the problem, because
Mm-hmm.
that gap still exists even among the specialists. So really, what that I guess led us to do through the most recent version of the Think Talk Treat Migraine program was look a little deeper at what the root causes were, and think a little bit beyond education, that
Right.
maybe it's not a lack of education. Maybe it truly is about communication between people with migraine and their providers. And
Mm-hmm.
so, kind of leading into the next part of the question, really about what do you do in these interactions? How do you convey, your personal journey and your experience with migraine? I say, don't just dwell on the headache, first of all.
Right.
talk about the other issues, talk about the impact, including the impact that happens between attacks.
Mm-hmm.
Talk about how if this is your story, that like so many other people, that you're coming in for help, not because you have a lot of headache days, but because those headache days are actually making it hard to manage work, school, life, and that you may be, you wonder if maybe you're a candidate for treatment.
Right. I can't help but wonder, something that comes to my mind, some people might just assume that their healthcare provider understands these things, and so they don't say them. But there's also the other end of the spectrum a little bit. Someone like me that was so sick from such an early age, there did become a point where it was almost too scarring for me to talk about.
Yeah.
And I had to learn to speak about it again. I was so quiet for years because it was just too painful to talk about my pain, if that
Yeah.
makes sense. And so, like, if you're one of those people, you got to practice crawling out of your shell and speaking about it again. I think just a personal statement for, those of us who just find it painful to discuss. That's also another thing I think that makes us quiet.
Actually, to that point, I apologies for jumping in there, but you're absolutely right that
Mhm,
again, pointing to overcome, almost half, so about 45.5% of people with migraine actually hesitate to seek care. And
mhm,
a lot of it has to do with stigma,
mhm,
including the belief that they're not going to be taken seriously,
mhm,
including the misunderstanding that their disease is not serious enough to warrant treatment. And so
mhm,
the things that you're talking about, your personal experience seems to be well in line with what a
mhm,
lot of people out there are experiencing.
mhm. Yeah, so it can be very hard to overcome that block at some point. If either you're afraid you won't be taken seriously, or it's just physically difficult for you to discuss how painful it is, I think. And so that's one of the things that I think we can help to do, is encourage people to go, have a plan and get back in there and speak to your healthcare provider. And we have this data now, and we have these sentences where we can use the words and ask if you're a candidate for preventive medications.
Yeah.
So if
You know,
anyone is, oh, go ahead. I'm sorry,
Oh,
Dr. Vargas.
I totally agree with what you're saying, and it leads me to think about a couple of other things on
Mm-hmm.
this particular point about communication.
Mm-hmm.
Uh, that I've really hit hard on communicating impact with the
Mm-hmm.
provider, but here's kind of another interesting nuance that I think is going to be interesting to your listeners. It's that when we actually started to dig in deep and we went to the providers, we went to the neurologists and the headache specialists, and we said,
Mm-hmm.
"Hey, look, this gap exists even in the specialties.
Mm-hmm.
Why is this happening? Is this an educational thing?"
Mm-hmm.
And of course, as you can imagine, a lot of the providers that we spoke to said, actually, no,
Mm-hmm.
we know what migraine is, we know how to treat migraine, but a lot of times our patients are the ones that decline treatment. And
Mm-hmm.
so that led us to then go talk to patients and say, okay,
Mm-hmm.
what are the causes for which you may be declining treatment? And again, pointing at overcome for reasons people decline, at the top of the list, fear of side effect issues,
Mm-hmm.
uh, wanting to not experience the stigma of being on a treatment,
Mm-hmm.
not understanding that migraine is a disease. So thinking that somehow this treatment is just covering up a symptom rather than treating the
Mm-hmm.
disease. And so I think this is sort of a long-winded lead in to not only do people with migraine need to talk about impact, but then
Mm-hmm.
they need to talk about the fears that they bring with them to that
Yeah.
clinic interaction. And when a provider makes a suggestion for a treatment, to not um, ask those questions, right? And to resolve those issues in your mind,
Mm-hmm.
be 100% willing to ask, what is this medication? What are some of the things that I should be looking out for? What are the
Mm-hmm.
appropriate ways that I should be treating it? What are the other options? What are the risks and benefits, or the potential risks and benefits? And I think these are all questions that sometimes I'll even point to myself because I'm a patient too sometimes, and these
Hmm.
are even things that sometimes I forget to ask.
Right.
So yeah, impact and those fears, and I think hopefully that'll help bridge that gap.
Right. I think I would even add to that for some of our listeners that have been doing this and have been had migraine or chronic migraine for so many years, fear of another treatment failing us.
Mm.
Um,
Yes.
that is one of the things that holds us back. We hate that, or fear of, oh, another diagnosis that doesn't pan out, et cetera, et cetera. Those are some of the things that hold back the people that have been sick for a very long time and have tried numerous treatments, I think. So, speaking to, a little bit of everyone there.
Definitely.
I think it's okay to say that to your healthcare provider, see if they can alleviate your fears a little bit. Um,
Absolutely.
you're right. So if anyone is looking for more guidance on communicating with their healthcare provider, and is looking to optimize their treatment plan a little bit more, there is a program available called Think, Talk, Treat Migraine. We have talked about it on Headwise before. We've introduced it, and we had very positive feedback. It's there to help us with this process. So Dr. Vargas, can you please talk us through how this program might be helpful to us as patients?
Yeah, no, happy to talk about the Think Talk Treat Migraine program at thinkmigraine.com.
Mm-hmm.
It's a program that means a lot to me and a lot of my colleagues, just as we've been working on this now for over 2 years. Really, what it's about, it's not an educational program, and I can't underscore that enough
Mm-hmm.
because I think there are a lot of educational programs out there.
Right.
This is an activation program. It's really meant to activate people with migraine to talk about their symptoms, to talk about their impact, to talk about the things that they fear about treatment,
Mm-hmm.
and things that they may not understand or not understand to their satisfaction about what migraine is. So
Mm-hmm.
that's one arm of it. The second arm is really aimed at providers, and there are so many educational programs out there that to be honest, the people that consume that information a lot of times are people that are not necessarily the ones that need it, right? They're the people who are enthusiastic about migraine and they
Right.
want to learn more. So a lot of our program was about how do we reach people that either don't realize that they need that supplemental information and activation, or may just not like treating migraine despite the fact that it's so common and so common
Mm-hmm.
in their practice. And
Mm-hmm.
so a lot of our focus was on reaching a very wide population of providers and activating them to take action whenever they see someone that is experiencing impact.
Right.
I think one of the other more important features of the program is that we highlight consensus statements and guidelines by the AAN, so the American Academy of Neurology, and the
Mm-hmm.
AHS, or the American Headache Society,
Mm-hmm.
and even the NHF, the National Headache Foundation, all have a lot of information about appropriate treatment and the appropriate time to initiate treatment. And so our program really looks to all of those organizations, which really lead the practice of medicine when it comes to migraine,
Mm-hmm.
as sort of a guideline for best practice.
Okay. So this sounds awesome. I want everyone to be able to hear the website again for Think Talk Treat Migraine. Can you please repeat it so they can get there?
Yeah, absolutely. It's just thinkmigraine.com. And the
Okay.
program itself is Think Talk Treat Migraine.
Okay. And so before we go, I'm wondering if we can close with, can you just tell us what you think is the most important piece of advice you can give to a person with migraine disease?
Yeah, I think that's a really great question because it makes me think of a lot of family members that I have with migraine and chronic
Mm-hmm.
migraine,
Mm-hmm.
and what I've seen firsthand in their behaviors and things that they do that that I think could change. And that's to be honest about speaking about what you're experiencing, being honest about the fact that you have migraine, which is a neurologic disease, and the fact that it may be having an impact on your life to some degree. And I think once we recognize those things, I think that helps educate others about what migraine is, but also about the fact that that it can actually be quite debilitating in the midst of an attack and even in between.
Right.
And so, so if there was one thing that I could say, it would be to be honest with yourself, be honest with your providers, and advocate for yourself to get the best care that you can. If you feel like you're having an impact that's making it difficult to function, ask whether you're a candidate for treatment. If you feel that that treatment isn't fixing your problem or addressing your problem or not making you feel well, feel free to talk with your provider and talk through changes that could be made or even a switch that could be made. I think more often than not, your providers really do want to help you. They really do want to be that person that you can count on to help you through it. But we need to be very, very transparent with information and honest with what we're experiencing to activate them to take the necessary steps.
Right. I love that. I love all these ideas. And I love the idea. This is a very empowering episode to me, because I love the idea of reminding people that the things we say and how honest we are can really help us get better care. Because sometimes we really get in a care funk. Sometimes it's like we aren't getting anywhere. And sometimes I think the things we say can really make a difference when we're in that space. So thank you so much, Dr. Vargas, for being here. This has been an awesome episode. And thank you everyone for joining us this week on Headwise. Please join us again next week. Bye-bye.
Thank you, Lindsay.
Thank you.